We are a Adun Service Centre, but a lot of NGOs have been serving marginalized communities. They have been doing a lot of hard work identifying the people within that community. So if you talk about the homeless, for example, Kachara Soup Kitchen, they actually have a database where they can also track where the homeless, go, where they've been where they were last seen, etc. So when you cut off NGOs from being able to supply urgent aid like food, medicine, other essential things so suddenly, then you put all these vulnerable groups at risk. We would really call on the federal government to rescind this instruction. At this time when supplying aid is urgent, time is of the essence. The government should decentralize as much as possible and let NGOs basically continue the good work they've done. If there are any, safety concerns, with social distancing, the government should advise the NGOs, maybe come up with a set of guidelines, make sure. I think actually NGOs are already following that, they're practicing social distancing, they're wearing masks and gloves when they go out, but the government can come up with a set of guidelines so that NGOs can continue doing their work in a way that is safe and responsible and in accordance with the Health Ministry guidelines. Correct, so that's the tricky part. I think I respect the Jabatan Kebajikan Malaysia very much and they do a lot of good work, but they're also very understaffed, and I don't think this is the time to actually be merging databases. It will just take too much work. It will be an operational nightmare. And when we talk about things like food goes bad really quickly. So if, let's say, an NGO brings the food to JKM, how fast is JKM going to channel that food out? Those are the questions that really need to be addressed.